thing you should never do in the pharmacy is assume. Never ever assume that that is a milligrams, written in milligrams. That mg looking like an mg is milligrams when the doctor meant microgram. There are rules, regulations we set in place so that we can minimize medication errors, and this is what we're going to be talking about in the next couple of days. Never ever assume. So if it doesn't have a date, don't assume that it's written the current year. It's not a valid prescription, because a prescription may look brand new. However, it was written last. Okay. There are rules pertaining to prescriptions as to how long is this prescription valid from the time the doctor wrote it. That clear? So this one. And then here comes your patient. Patient's name, patient's date of birth. Usually you don't see that on a prescription that is given to the doctor. Okay. And then the doctor puts the information, or the pharmacist asks date of birth or asks for your insurance card, all that information. This address is important, but not all prescriptions will have the patient's address. Okay. This is the patient's address. Here comes first law. Not first, but one of the laws I need to discuss. Patient's address is a must by law if the prescription, the drug written, or the prescription is a C2. But nowadays, because of our abuse problems, they wanted the address written if the prescription is a narcotic in general, all controlled substances. Again, state by state law differ. Federal and state laws differ. Another question that comes up on the PTCE very often, or all the time, not very often, is when state and federal laws differ, what is the answer? We follow the exact verbiage as whichever one is more stringent, and stringent means stricter. Clear? That always comes up on the PTCE, always. I'll talk about filing. Some states would like you to file prescriptions for 2 years, controlled substances, like federal has a different rule. When that differs, you follow whichever one's more stringent. It doesn't mean that federal is higher, we always follow federal. Whichever one's more stringent is the answer. The RX symbol is what you call superscription. Others call it the prescription symbol. It's okay. Fun fact though, RX came from receta, okay?